Hey guys, I'm back. Let's talk about diaper dermatitis. I got a picture here of a young kiddo. I just took a part of the kid just for privacy reasons, but pretty much this is what a diaper dermatitis is going to look like. Diaper dermatitis, diaper rash, pretty much the same thing. And this is pretty much inflammation of the skin due to an irritant such as urine or feces, or parents using new deodorants or lotions, and the skin gets irritated and becomes inflamed. So this is usually from prolonged contact with the skin. So if the parents don't change the diapers for a long time, and you get a mixture of urine and feces at the same time, you're going to get this eruption. The other thing that you can get is when kids take antibiotics. Put a kid on antibiotics, come back later, mom's complaining that they erupted with this, because some antibiotics can cause diarrhea in kids. So just remember, ask the parents about antibiotics. Did they start recent antibiotics recently? So as you can see, this is a perfect typical diaper rash. It's going to be shiny, it's peeling, it's erythematous. You can have some raising of the skin, macular and papular rash, and it's usually in the diaper area. Sometimes you can see it in the folds, skin folds by the diaper area. That's usually meaning that urine has got to that area. When it's more on the outside, it's a combination of urine and feces. So when the parents come in with a diaper rash, they want something to fix the problem. The kid's usually irritated, kids usually crying, and parents want a good solution. So education, again guys, is key here. You got to tell the parents, ask them how often are they changing the baby's diaper. I change the baby twice a day. No, that's not enough. Especially if the baby's having diarrhea. Kids urinate a lot, so you're going to have to change the diaper every 1 to 2 hours. Yeah, parents are going to look at you like, do you know the cost of diapers? But this is part of the teaching. You know, kids pee a lot. So change diapers 1 to 2 hours. Avoid using wipes. Tell them to use like a warm cloth and wipe. And then teach them about keeping the area dry. So maybe not having the baby in a diaper for an hour or so. Just have the baby lay on a cloth or something, and just kind of aerate the area, because that moisture, this is when this erythematous grows. You also want to talk about using protective barriers, such as Desitin is great. I use Desitin with my kids. A&D ointment as well. These are all protective barriers that help with the skin. Another thing is a sitz bath. Just a nice warm lukewarm water. Have the kids sit in there for about 10 to 15 minutes, and then apply the protective barrier ointment, the Desitin or the A&D ointment. Anything, look at the labels. Tell the parents to look at the labels and see if anything with zinc oxide in it. That helps repair skin very well. But the parents are going to want something better than over the counter. That's why they came to visit you. They paid their copay. So treatment is the key, but you have to also recognize this is a diaper rash. You have some raised edges. It's erythematous, but you also have to determine, is this a fungal rash, or is this more due to a mechanical, chemical issues, such as the urine or the feces? If you look at that dark area, that solid area right there, that's more chemical, right? But if you look towards the center of this, it's kind of lighter, and then you see those satellite lesions on the outside. If you see satellite lesions, raised edges, and like a central clearing, that is a sign of a fungal infection. The other way you can tell it's a fungal infection is ask the mom, when did it start? If it started more than 3 days ago, yes, you're going to see these satellite lesions. Now you're worried about more of a fungal infection. If it started yesterday, it's mostly more chemical, more related to the urine and the feces. So right here we have a little bit of both. We have chemical and we have fungal. So what's a good way to treat this? Well, clotrimazole and miconazole cream works great. Me myself, I like miconazole cream. Apply it after every diaper change. You can also have the parents, like usually I tell the parents to get the miconazole cream, apply this, and then on top of that they can apply the protective skin barriers. So it kind of helps keep that miconazole in, and when they put the diaper back on, it doesn't like rub off. So, and the other thing is I like nystatin cream. Nystatin 100,000 units. That works great for me. You can also prescribe them nystatin with triamcinolone ointment as well with it. So the triamcinolone ointment helps with the inflammation part of it and the itching, and that works amazing. So again, apply this, then apply the antifungals, and then apply the protective barrier ointment, and you'll see a vast improvement. And then you always have to worry about any type of bacterial involvement. If you do worry about bacterial involvement, some increased erythema, maybe some drainage, mupirocin ointment works well as well. So 2% mupirocin ointment, boom, you're well on your way. So remember, patient education is key. Talk to the parents. I know this is probably not a big deal to you, but there's a reason the parents came in. They don't know how to treat this. The baby's irritated. Just imagine if you had this, crying all the time. So you want to treat this, you want to take this seriously, you want to educate them, and then also educate them on how to apply the ointment. Alright guys, it's your boy, Be Rich, I'm out.